My name is Patrick O'Keefe, and I did my presentation on substance abuse treatment software. What is substance abuse treatment software? It's software used to help victims of a substance abuse disorder keep track of their progress. This often allows them to progress through their substance issues in the most efficient way that they can. The software can also help them get a start to recovery even when they cannot seem to get the motivation to do so. Many substance abuse centers will utilize a specific software to document the data for their patients. The data varies in it can include time spent visiting the center, progress since the first visit, severity or the type of addiction, therapy documentation depending on if the patient has gone to multiple therapists that they can work with, plan for recovery and setting their overall goals, and other health related issues of the patients depending on if their substance abuse disorder has an impact on those health issues. Foothold Technology is a technology company for healthcare software. They've been in operation for over 25 years. They support over 1,000 agencies throughout the United States, Guam, and Puerto Rico. They don't just do substance abuse disorder technology. They do a wide variety of software to help meet an organization's specific needs depending on who they're working with, but they do a very wide variety of everything. However, their substance abuse software is what I will be focusing on today. To go over their substance use disorder software, they have extensive experience with substance use treatment providers over their 25 years in office. Their software is flexible and configurable, makes managing all data for substance abuse treatment and recovery programs much more convenient. They're committed to advocating for the highest quality treatment available for the public, designed to be easy to use for clinicians regardless of the treatment model and use with the organization. So they try to make it flexible and adapt their software to whatever the organization's needs are. Their treatment planning is efficient and accurate. It helps be as much as it can. Easy to use, progress notes, scheduling, and medical features are all offered by their software. Regulatory requirements with expertise experience also is a part of their software as well. To highlight over their main features, this is the build of their entire software. Specifically, they have a form builder that's used to create forms and assessments to track the agency's needs, a report builder to build custom reports to analyze agency operations, update funders, and track the outcomes of their patients. They have a plan builder to create custom treatment plans to monitor goals, objectives, and outcomes of patients. They also have a billing builder that's used to manage Medicaid, Medicare, third-party, and direct contact billing, just depending on what your healthcare provider is, or your health insurance provider, I'm sorry. And then to continue off of these software features, they have lab results. They have an electronic platform for sending lab orders securely across the country. They have a progress note section to document services for inpatient and outpatient clinics, individual or group counseling programs, which goes hand in hand with the therapeutic notes that I was talking about in the beginning of this presentation. They also have a hospital module, which goes over detox, rehab, and hospitalization records, and monitors emergency room visits. So basically, this is used to keep track of what a patient's history is. If they've had a long history of substance abuse disorders, it goes through all of the detoxes and rehabs and hospitalization records that they've had in the past to make sure that they aren't doing something that didn't work before, or they can just give them the best care possible. And then their medical module is a centralized location for medical information in general. They can make e-prescriptions through it, medication administration, immunizations if patients need it, and more. And that's about it. These are my references as well. Thank you.